My name is Caitlin and we are going to do a walkthrough of what it's like to be a dental hygienist. I am just about ready to get my patient, Sarah. Hi Sarah, how are you today?
I'm good, how are you?
Good. We're going to go back and I will show you where you're going to get your teeth cleaned. So how's your day going?
It's going good. I'm excited to be here today.
Yeah.
I want to learn about it a little bit more.
Okay, go ahead and have a seat in the big chair in the middle of the room. Go ahead and come in here. So I'm going to show you guys a few things in my room. First of all, one of the first things we do is we put on patient bib to make sure that we get nothing on Sarah's pretty shirt here. Next, we get to take a look at her x-rays, but first I'll show you where our x-ray machine is. It's right in here. So this is our picture taker, gets to take a look through Sarah's teeth. It's a black and white photo, but it's like x-ray vision because we can see in the middle of her teeth, all three layers. This is the sensor. This goes inside of her mouth and it catches the x-ray, and my cord sends it all the way to the computer. So let's go see what it looks like on the computer. All right, these are called bite wings. These are basically how Sarah bites together. She also has a full series where we can see the roots of her teeth. So the very white part of her teeth is called the enamel. Then the next layer is the dentin. And the very middle layer is the pulp. That's where the nerve is. That's how you can feel cold and hot things on your teeth. This one is called a panoramic x-ray, and this shows her jawbone and her palate. And this little bar here is because Sarah had braces, and that is what's keeping her teeth nice and straight. Okay. So next,
I have a question. How often do I have to take x-rays?
how often do you have to take x-rays? Well, we usually like to take them about once a year just to make sure that there's no cavities in between your teeth.
Oh, okay.
All right, thanks. Great question, Sarah. All right, so we're giving Sarah some safety glasses and we're gonna tip her back. And I'm gonna put my safety glasses on and a mask, so we don't spread any germs. My safety glasses, they're called loops, and they have magnification. Can you see my eyes? Do they look really big? Mm-hmm. And then I have a light, kind of a blinding light, but it helps me see inside Sarah's dark mouth. Then we need gloves, and we are going to take a look and see her teeth. Let's take a look at her retainer on the back side of her teeth that we could see on the x-rays, the metal bar. Let's take a look. See, that's how it looks inside the mouth. Metal bar from there to there, so it's keeping her teeth nice and straight and beautiful. And one thing I want to do is to dye her teeth pink. So what we're going to do, we're going to put a few drops of this dye. The technical term is called disclosing solution. And the cool part about disclosing solution is that it only sticks to the plaque or the extra food debris that is left behind. So what we do is we put it on. Good thing she has chapstick on because it could stick to her lips. Put it on, and Sarah has nice clean teeth, so it's not sticking anywhere really. But we are going to do a little rinse. And I just thought about this. We might not have water right now. Do we have any water, Lauren?
No, and if there's Mint-A-Clean in it. No.
All right, well then I'll wipe the excess off with some gauze and we will see. That her teeth are so nice and clean that there's no plaque left behind. But there is a tiny little bit of pink that I will polish off. This is my special toothbrush. It's called a polisher. And my pedal down below, it makes it run. Let's turn it on. These are our sterile instruments. We have to open our package, get our forceps out here, and turn the switch. Make sure that it's gonna run. There we go. That's how it sounds. What flavor polish would you like, Sarah? Would you like mint, cinnamon, strawberry, or orange vanilla swirl?
Ooh, let's do the swirl.
Okay, let's do orange vanilla swirl. This is our special toothpaste that is gritty so that it can remove any stain or any plaque, which is left over from food. So I just pick up some toothpaste and we polish our teeth. Get all of that pink off. And then we are going to give her a rinse. Let's give her some suction. And the vacuum's turned off, so we're going to pretend to give her a suction. This is my slippery straw here, and it's like a vacuum, tiny vacuum, and it sucks everything out. Okay. And we will floss next. We'll floss some of that polish in there. Sure wish we could rinse it out for Sarah.
Water if you want.
Yeah, but we don't have suction.
Well, she can spit it into the sink.
That's true. Just put it back into the cup. I have a cup right here. So normally when the office isn't closed and everything's not shut off, what will come out of here is air and water. And this would be my slow suction or low suction, and this one is a high volume suction if I really need to suck a whole bunch of things out of somebody's mouth. So I'm going to sit Lauren up here a little bit so she can switch with this. And I think it's kind of warmish.
Oh.
All right, thank you.
Thank you. Oh, it feels so smooth.
Good. All right, so then we get to talk about brushing a little bit with our patients. We do a lot of education, and we have different tools. I can turn off my spotlight here and take off my glasses now. Like I said, these are the layers of the tooth. This is the enamel, and this is the porous dentin. All those little pores, they go straight to the nerve, which makes you feel when things are hot and cold, like if you bite into ice cream or something. These are where we teach patients about proper brushing techniques and to angle the toothbrush bristles into the gums. And that is how your toothbrush is supposed to be angled so that you can massage your gums and keep them nice and happy and not bleeding. And we talk about proper flossing and wrapping that floss around our middle fingers and using all 4 of the other fingers to maneuver it in between the teeth. You can also use the floss picks like these. There's all kinds of fun things to clean in between your teeth. And this is if you have braces. Some of you kids might be getting braces soon. There's all different ways you can clean around braces. It's kind of hard, but it's very, very worth it once you take your braces off to have brushed your teeth really well while they're on. All these things fit on all sides of those brackets and under the wires. And yeah, that's about it. That's pretty much a day in dental hygiene. At the end of the visit, we give patients a goodie bag with some mouth rinse and some toothpaste and some floss and a cool toothbrush, like one of these guys. Okay, nice to meet you guys. Have a great day and have fun with Amanda.